Thanks, Taps. So as if being in the middle of a pandemic wasn't bad enough, community healthcare workers in the Free State say that their contracts with the Department of Health have not been renewed. According to HOSPERSA, a trade union for public healthcare workers, many have also not been paid in as long as 4 months, yet they continue to serve their communities. Want to tell us more? We are joined now by Peggy Motlokoa, the chairperson of HOSPERSA in the Free State. Peggy, a good afternoon to you, Mama. Thank you so much for speaking to us. Let's start with the renewal of contracts, what you understand exactly to be the word from the Department of Health and, of course, some of those community healthcare workers themselves.
Good morning, Naledi, and your viewers at home. Thanks for having me. Naledi, the contract is being renewed every year from 2018. Every year in June, it's being renewed, but there are delays every time. As we are speaking now, they are now serving the department, but they are working without the contract. And we have also 7 CHWs who have not been paid for 5 months. Their stipend, they have not received their stipend for 5 months. We have lost counts as HOSPERSA, how many times we have engaged with employers, starting from the director of the district, Mfutsanyan district, and the HR manager. But we are being sent from pillar to post. No one is accounting. You find yourself being surprised if these people have not been getting their stipend for 5 months, but rendering service each and every morning. Even now, if I can tell you, they are at work. They are now at the vaccination centers, but they haven't received any stipend for 5 months, and no one is accounting. They are pointing fingers at each other. We don't know what is really the problem, because they know that in June every year, the contracts of the CHWs comes to an end. So it must be renewed. So we don't know what is really happening.
Right.
And as HOSPERSA, we have been engaging with the department several times. I even forwarded those names to Mr. Mbambi, Monji Mbambi, for him to assist. But till today, even Friday, we were promised that this month end, they will get their stipend, but nothing. Yeah. They have not been paid for 5 months.
Surely these community healthcare workers are essential, especially in the rollout of our vaccine program. What happens if we're not able to retain them?
They are even more important than even nurses. I'm a nurse, but CHWs are playing a very crucial role in the Department of Health. They are tracing for TB, HIV, but now they are at the vaccination sites. They are working overtime, of which that overtime, they are not even being paid. Nurses are being paid for overtime. Instead of knocking at 2 o'clock, they are knocking at 5 o'clock, but they are not even getting overtime. But worse, they have not even received their stipends.
Yeah, and it's important to note that
But they have to. Yes.
I'm going to. Yeah, I'll let you finish your thought.
Okay, they have to wake up in the morning, and they are using taxis. Their policies, they are now saying their policies, funeral policies, have lapsed.
Right.
Remember, these CHWs are not even permanent. They are on contract.
Right.
So if now their policies have lapsed, how are they going to bury their loved ones if something happens to them?
Yeah, Peggy, thank you so much for speaking to us. Yeah, I'm out of time, Peggy, but we really will be following up with this story, because last year there was a similar issue with community healthcare workers in the Free State, and it seems to be an issue every year. But that there, Peggy Motlokoa, chairperson of HOSPERSA in the Free State. Now, we have reached out to the Free State Health Department's MEC and the spokesperson for right of reply. We await their response.